distinguished guests and colleagues who are here today. I want to thank Bela for inviting me to come, because it has also given me a chance to connect with old friends and colleagues. Ndugu Rwanda, with whom we go back many years, even before the current government came into office in the struggles to liberate this country. My older sister and mentor, Noreen Kaleva, who started me on this journey of HIV. Ade, for whom we have had joint leadership with others in this country for HIV. Alex Muganzi, Flora Banage, Jane Waterman, Wim. Our lives have intersected in many ways, and so thank you for giving me a chance to talk about leadership, particularly when the Right Honorable Prime Minister is here. Since I'm coming back from Rwanda in 8 weeks and I'm looking for what next to do, you never know. So 40 years ago, exactly 40 years ago, I was a 19-year-old medical student joining Makerere University, Makerere Medical School. In a few months, it will be my 40th anniversary. And at that time, Idi Amin was still president. And I did not know if Idi Amin would ever be removed. Of course, Ndugu Rwanda knew he was going to be removed because he was at the forefront of the overthrow of Idi Amin. But that is how long ago my medical career began. In 1978, there was no known case of HIV, even though HIV was starting very slowly to appear. We had not recognized it. And I did not know that HIV was going to define my career, and that from the very first case of HIV that I saw in 1982, the rest of the 36 years of my medical practice would be mainly defined by HIV. And in 1978, I did not realize that even as I aspired to be a doctor, as I was looking forward to healing people and healing society, that my tools would not be the stethoscope so much as the tools of leadership. And in those 40 years, I have been learning and practicing to be a doctor for 20 years, but for the other 20 years, I have stopped practicing as a doctor and have practiced much more as a leader. 3 years in Swaziland, 14 years in Uganda, and now 3 years in Rwanda, working with government in the fields of oncology, non-communicable diseases, mental health, and maternal and child health. But as I said, in 8 weeks, I will be back to continue with that leadership journey. So what I want to share is really personal stories and lessons, rather than trying to give you a thesis on leadership. I think in the 2 days you will cover many things. I will start with 4 observations that govern my life when I'm thinking about leadership. The first is that leadership is most visible when it is absent. In many ways, when leadership is happening, we take it for granted. We take it that things are going well. But as soon as leadership becomes absent is when you realize how important leadership is. Ask the people of Somalia. Ask the people of Southern Sudan. Ask the people of Congo and other places where civil war has erupted. Ask the people of South Africa when President Mbeki denied the existence of HIV. So it's important to understand that good leadership is we take it for granted, but when it is absent, we have a problem. The second key thing I want to observe is that we all have leadership within us, all of us. But in order to unleash that leadership, we have to remove the barriers that obscure it. I learned this lesson in Swaziland many years ago. We were at a workshop at a hotel like this, and there was a sculptor who was the sculptor in residence who would actually sculpt as you watched and then sell the carvings. And over the 3-day workshop, we watched him carve a duck out of this piece of wood. And we asked him, but how do you do it? How do you know because he was using very crude instruments. And he said, it's very easy. The dark is already there in the wood. My job is to remove the unnecessary piece of wood around it until the dark comes out. And that is what leadership is. We all have leadership. It's inside there. But sometimes we obscure it because of our self-esteem. We obscure it because we believe others will do it. We obscure it because we believe we are not leaders. So that's the second. The third is that the greatest responsibility of leadership is to empower and develop leadership skills in as many others as you can and eventually pass on that leadership baton. We do not live forever. Without these glasses, I am blind. And the passing of age is becoming more and more evident as I come to 60. And in this room, someone came to me and said, thank you, Dr. Coutinho. 15 years ago, you helped me start the leadership journey. And that is an important thing, and this academy is going to be very important in doing that. And the last one is a statement about humility. And the statement goes like this: success has many mothers, whilst failure is an orphan. When something is successful, we are very quick to say, we are part of it, we are part of it. That's because of us. Unfortunately, when there is failure, it becomes an orphan and you have to take responsibility for it. If you ask Right Honorable Rwanda and the minister, they know this. When things are not going well, people are pointing fingers to you. When things are going well, we start saying, we have done great work. And as leaders, we have to have that humility to understand that whatever we do it as we. But when it comes to failure, we also need to step up and say, I, because that failure is an orphan. So, in my 40 years, what principles and values have driven me personally? Because you cannot have good leadership without good principles and values. And as I was preparing for this talk, I started distilling what was it that led me to become a doctor and become a leader in the health. And there are 4 principles I follow to this date. First is that life is sacrosanct. Life is sacred. And that the privilege of being able to protect and save life is not given to many. And that all of us as healthcare workers, if we regard life as sacrosanct, that should drive us to be better leaders, but also better practitioners of health. The second principle is that health is a universal human right. There is nobody who deserves good health and someone who deserves bad health. I have never ever worked in private practice because of that principle. Because unfortunately, private practice does divide those who can pay and those who cannot pay. And I truly salute Uganda and its struggles to achieve universal health coverage because health is a universal human right. The third principle is personal. And I believe it that we as health workers are called to our profession not just to serve man or woman, but to serve God, for those of us who believe in God. I always tell my staff, the quickest way to heaven is to be a good healthcare worker. Quickest way. When you get to the pearly gates, you will be welcomed. And for those who believe like me, this is something that they might, I see Noreen adheres to that principle. It's not necessarily for everyone, but for me it's important. But the fourth principle is a very interesting one, and it took HIV to teach me this principle, that people and patients are equal partners with a voice, a vote, and a vision of how they wish to be served. Before, when I became a doctor, we were small gods. Take off your clothes, swallow that medicine, come back next week. We never really regarded patients and people as our partners in the journey to good health. And so this has become an important principle, and HIV has taught us because of the advocacy of people living with HIV and AIDS, people affected by HIV. And we are now trying to export that principle. And you cannot achieve leadership if you are just leading the healthcare workers and don't appreciate that you are also the leader for the people and the patients who require those health services. So, using those principles, my vision, because again a good leader has a vision, is that the reason we lead for health is that we want a shared better future for all humanity. It goes beyond health. It goes far beyond health. And health is the springboard for development and prosperity and happiness. I learned a lesson from an investment banker, interestingly. He came to me and said, Dr. Coutinho, how much money do you want? I said, well, it's never enough. He said, how many zeros? Just tell me in zeros. How many zeros? I said, in shillings or in dollars? He said, in dollars. So I said, okay, 7 zeros. So he said, if you add 0 plus 0 plus 0 plus 0 plus 0, what do you get? He said, 0. What gives the 0 meaning is the digit that you put in front of it. As soon as you put a 1, it becomes $10 million. As soon as you put 2, it becomes $20 million. He said, all that money you want is the 0. The digit is your health. If you don't have health, the rest is completely meaningless. And you ask anyone who is confined to a hospital bed, cannot speak, cannot talk, and needs to be changed their clothing, they will tell you how important that digit is. So my vision is that we focus on that digit because it gives meaning to the rest of life. And the third piece of my vision is that our population, our people, my fellow Ugandans, are empowered to both demand good health, because we have often just supplied but not demanded, but also provide their own health, that they have the skills to provide good health to themselves. There are many things outside of the health facilities that the population can be empowered to do. And these are things that I have run through the course of my 40 years, I suppose, as a medical student, as a doctor. I will not go into all the pillars of good health systems. I'm sure you will touch on those. I want to give you something that hopefully you remember. 2 things. First is that health is a sector-wide approach. And the Honorable Prime Minister knows that. In fact, the Health Ministry, with apologies, Madam Opendi, the Health Ministry is not the major contributor to health, frankly. It is the other ministries: education, agriculture, employment, housing, water. Over and over again, in whatever country, the progression to good health has come from a sector-wide approach. And we should be very, very grateful that a senior doctor, senior health worker, former Minister of Health is our Prime Minister and leader of government business. Because it is through the leveraging of all of these sectors that will take us to health. The other piece of a good health system is the PPP. What does PPP stand for? Public-private partnership. I beg to disagree. I beg to disagree. Yes, it does mean public-private partnership. I want to introduce you to 2 more PPPs in leadership. The first PPP is the patient-practitioner partnership. Patient-practitioner partnership. When a patient comes to you and you say, look, you have hypertension. Now we need to become partners to manage your hypertension. Let's lose some weight. Let's reduce your salt. Let's do some exercise. Here's a thiazide diuretic. We would like you to swallow it every day. You are building a partnership because your knowledge is not enough. The patient must be your partner in following the guidance and also giving you feedback. So we really need to understand, I come back to this, the patient as a true partner in health. So that's the first other PPP. And the other one is one that Honorable Ndugu Rwanda referred to, which is policies for public health programs. PPP, policies for public health programs. Because you can do your research, and we will hear a lot of research. If it stays stuck and does not move into the policy framework of the government, you are not going to get a change in your public health programs. And as much as you want to run curative programs, you will never achieve health if you don't do a multi-sectoral approach and a public health approach, which is why perhaps I specialized in public health. So those are really the two. There are many other pieces, but because of time, I wanted to abbreviate to that. So I was asked to talk about my leadership style. Of course, we lead in different ways, but there are a few things that I believe I can share and why I think I have been effective with my teams in leading key institutions across the last 20 years. First, I lead from the front line. I am not a leader who likes to lead through the computer. I have tried to tell my staff, this computer style of leadership that I see these days, sending each other emails but never stepping in the front line, does not work for me. The people we serve are at the front line. And yes, there will be need to stay in Kampala and so on, but if you do not go to see what the challenges are and what you need to do, you are not going to be a good leader. The other is the language of leadership. The other day I listened to a tremendous leader in South Africa, and I instantly recognized the language of a leader, instantly. Because she was saying, we, the team, us. You will notice Honorable Hakana Rugunda said, we salute you, Adi, and of course you work with your teams. Leadership is about teamwork. If you cannot lead, if you cannot inspire a team, if you are always saying, I did this, I did that, sorry. At least in my leadership school, I will give you failure. A lot of leadership, so I'm moving on, a lot of leadership is about cheerleading. You know, when things are going well, the best leadership style is to cheerlead. When Honorable Hakana Rugunda is being taken by the minister to see a successful project, his job is to cheerlead, is to say, my team is doing a great job. And sometimes we forget to cheerlead. We are just pointing to problems. But when problems do occur, that is when leadership requires to be making hard decisions, to be taking charge. So you have to be able to switch from being a cheerleader to being the person who has to make the hard decisions and resolve problems. The other key thing for a leader is personal responsibility. Those whom I have led will know I am very good at making public apologies. If I have led badly, I will say so, rather than blaming others. In this culture in Uganda, I will tell you a funny story. You know, we have many, many cultures, but long ago, in the monarchs, there was one of the kings had a special subject who was given the name of Munyampi. The Ugandans will recognize this. Because the king was so elevated that the king could not pass gas. So if the king passed gas, they would start blaming this Munyampi. You, go away, so that the king could be protected. But leadership is not like that, in my view. I think good leaders, strong leaders, are strong enough to say, this area we need not do as well as we did, and people will respect you better when you are leading them to try to resolve those kind of issues. The other is really empowering others and creating the space for creativity and risk-taking. There is no way that you will progress unless you have innovation, creativity, and a bit of risk and risk management. But a leader who does not empower others and create that space is not going to go anywhere very long. They will just keep the status quo. The other very important thing that I adhere to is what I say, praise in public, punish in private. There is nothing as demeaning or as demoralizing to your staff to be punished in public. You, what's wrong with you? You're useless. The public space is for praise. The private space in your office is for punishing. You will be respected as a leader if you adhere to that principle. So there are many others, but let me put my last one there, which is be very clear as a leader what is zero tolerance. Because you see, as a leader, you are going to have many people working with you and for you. And many of them will make mistakes. And you will have to build them up to learn from their mistakes. But it is important that you say, this mistake, I will not build you up. This mistake we shall separate. Because the people you lead should be very clear what you have zero tolerance for. As an example, theft in a workplace, zero tolerance. Fraud, zero tolerance. Sexual harassment, zero tolerance. Assault, zero tolerance. Disrespect to patients, zero tolerance. And when it comes time, because leading also means making these difficult decisions where staff are not performing. If there is a zero tolerance policy that they are aware of, then there is no negotiation at that point. But, it's the first time that I stole. Please forgive me. And that, I think, has helped me in having a very clear agenda. So, as I wrap up, really, because of time, I will not go through every single thing I wanted to do. I want to ask us, why are we leading? Why do we want to boost the leadership, particularly of the health sector and healthcare workers? We have heard some of the data that with better leadership, you get better attendance of healthcare workers. With better attendance of healthcare workers, you have less waiting time for patients. What we've not heard is, what is the impact of that? Because in the end, leadership is about better health, at least in the health sector. Leadership is about better health, and better health leads to a better life. And if everybody had a better life in Uganda, we would have a better country. And that's really why we lead. And in keeping with the motto of our country, I would like to end to say that we lead for God and my country. Thank you.